Hello, how you doing? My name is Stephen Edwards, and I am. This is the provider tutorial. During this tutorial, we are going to be showing you how to navigate through TheraPlan, basic dashboard functionality. We're going to go through patient information and show you some basic business cycle and research systems that we have inside TheraPlan that's going to help you navigate and be able to pull everything up that you would like. This is a live webinar, so if you are on this, I want to bring your attention to the section that says questions. You are muted. If you have any questions throughout this live webinar, please go through and type in your questions. I will be asking throughout the webinar if there are any questions. You can ask a question at any time, and I will go through those questions and make sure that they're answered for you. So first, I want to make sure that everybody is able to hear me and they can see the screen. If you cannot, please send me some communication via the question, and we will be able to help you out with that. So first we are going to, this is the sign-in page. I am going to sign in as a PT provider. Within TheraPlan, as a user, you are designated a role. And that will allow you to see certain things inside of TheraPlan. So when I say that I am a PT provider, that would be my role as a provider. So when you sign in, you will see exactly what I'm looking at. If you are an admin provider, meaning you do some administrative functions and your role is admin provider, you're going to want to watch a different tutorial that will show you how to unlock or delete encounters, and there's some other administrative duties that you can do in there. So again, this is the sign-in screen. The username is Donna. I have my password in. I want to draw your attention to forget password. If you do forget your password, you would click here. Just like other applications, it's going to send you an email to the email that is in your user profile, and that will lead you through updating and making a temporary password so you can get back into the system. So I'm going to go ahead and sign in, and it's going to bring me to the landing page. This is our dashboard. So the first thing we're going to talk about is the dashboard. And one thing I want you to take notice in this patient list. This table, this look right here, is throughout TheraPlan, and I'll show you, and you'll be able to see that throughout the system. You'll have a search bar above a table. You'll have a show, and this is how many files you want to see at that particular time. The system is set up. Me as a provider, I am only going to see the patients that I have a case for. I'm only going to be able to see my patients. So if your caseload is 7 patients, you will be able to see all 7 patients right on this tile that you can pick and click on, and it's going to bring you. We'll click on Justin Bieber real quick. It's going to take me right to the patient details. We do use web technologies inside of TheraPlan. So if I'm going down the road and if I'm a home therapist and I'm on my way to somebody's house, I can bring up TheraPlan on my phone. I can click the phone number on my dashboard, and on my phone, this is a desktop, so I do not have this set up to a phone. It will ask if you want to call that number, and it would start that phone call for you. On all of the tables, you'll notice that if you click on the top of it, it is going to adjust all of the columns in alphabetical order, and it will put all of your columns in sequence. So you can do that on any table within TheraPlan, okay? So we're gonna go through the rest of the tiles. You have your scheduler tile. If I'm a provider, if I'm in clinic, I can right click and I can check in, I can cancel appointment, I can no call, no show, and no call, no show charge. We have the difference in no call, no show and no call, no show charge is because you cannot charge a Medicaid recipient. So there is a differentiation in that. If I wanted to check this person in, I would just check in at that time. If I want to see my full scheduler, I'm going to click scheduler, and it's going to bring up the actual scheduler. And it tells you the times on top, and this is me. I'm only going to be able to see myself because I am just a provider. I am not admin provider, which in turn I would see everybody's schedule. Now we do have two appointment management systems inside of TheraPlan. This is the scheduler. Excuse me, this is the calendar. And the first one I showed you is the scheduler. This is the scheduler. So there's different functionality. We're not going to get too deep into it on this tutorial. There is another tutorial for scheduler that will take you through everything that the scheduler has to offer, the appointment management systems. So we're going to go back to the dashboard. Next would be the message center. This message center is totally HIPAA compliant. If I want to send somebody in the administration team a message, an instant message, I would go here, say hello, and it's going to send, in this case, Stephen Edwards, a message saying whatever I want to tell that person. Okay, we will be adding functionality to this message center. So look for some pretty cool updates as we move forward with the message center. Open encounters. This section, again, you see the table with the show and the search bar, very consistent throughout. This is going to log all my open encounters, which are treatments, being evaluation, treatment, or therapy care plan that I've started but have not completed. So this will house everything for you. If I wanted to start the process of getting that note done, I would just click on it, and that encounter is going to come up, and I can just save and view, and then I can go in and start filling out that documentation. Documentation is not going to be gone through in this tutorial. You can go to Help and Forms within TheraPlan and do the tutorials on documentation evaluations and the tutorial on the daily progress notes. Payroll. Payroll is going to be a great for administration along with providers. It's going to be very transparent, and if you want to dig a little bit deeper into payroll, there will be a tutorial exactly on payroll from an administration side and a provider side. But know, when we were designing it, we designed it with transparency in mind, that a therapist will be able to see everything that they've been paid on and everything that is outstanding that they have not been paid on. So transparency was a big factor in getting that payroll functionality done. So please go to Help and Forms and watch the tutorials on the scheduler. There's a separate one on evaluations, a separate one on daily progress notes, and lastly, there is another tutorial on payroll. So we're going to keep on with this, and we are going to go into patient information. So if I wanted to take a look at John Cena, you'll notice this is all of their basic information, their phone number, their age, their name. You'll notice up here, if you put on hold yes, it's going to ask you for a reason: financial, no authorization, no plan of care, other reason, or scheduling. You want to be able to tell if somebody is on hold as a provider, so you do not treat that child or adult or just that patient while they are on hold. These two buttons here, we'll go through these real quick. Add new notes. This is not your encounters. This is a note that you want to document. Maybe mom sent you an email, and so you could, category would be patient, and you could say, mom is going to be late again. Oop, there is spell check. and you're going to save it, and that is going to log it. When we go down to the notes on the bottom of these accordions, I will show you that message that we just did. So you'll see that add new encounter is right below that. If you are not engaged in the scheduler, which I know some providers like that calendar book that they keep their scheduler in. So if you are not using the scheduler or calendar in TheraPlan, this is how you would start a new encounter, just by clicking add new encounter. And it is going to start where you document the date and the time. So let's say it was today, and you would go through and push tab and put in the time to and from and what kind of treatment it was. But again, this will be totally vetted through as we do the tutorial for documentation. So you can see that you can get to documentation in 2 clicks. If you're on the dashboard, you go into the patient and you click add new encounter. That's how easy it is to get to the documentation to start. Next, we're going to have primary contact. I know that many of you see pediatrics. You are obviously not going to want to call the child, and most of the time the parents are going to give you their phone number in replacement of the patient. So primary contact is the phone number that shows up on the dashboard for you to call. Financially responsible, if this same person is financially responsible, you would click this, and that would transpose that information right to this bottom financially responsible. Primary insurance, secondary insurance, and tertiary insurance. All of these have the same function. You'll notice that they have the table with the pertinent information right here. You'll also notice throughout TheraPlan on the table, the far right is the status, and it could be active, inactive, pending, but that visual cue with green being good, red being an active patient, so you want to make sure that you make that person active again, and you check all their insurance information if you haven't treated them in several months or anything. From this screen, you can add a new insurance. For many of you, this will be a function of your administration team, but if you are going to be an admin provider, you'll want to watch the tutorial for admin providers. That is that provider that also does those administration functions. I will give you notice to the authorization required. In this case, PT is required. I am in here as a physical therapist, so when I look at the primary insurance, I will see that PT does require authorization. So we will go into the authorizations. Again, you have that table look with the status, the visual cues on the far right-hand side. You can take these and you can sort them by clicking on them any way that you want. This will list the authorizations by specialty, by the type of insurance, by the insurance name, the start and end date, visits remaining, and units remaining. We all know that there's 3 different ways that you need to track authorizations. You have the dates that it's effective, the visits, and the units. Not all insurances give you visits and units. CMS Title 19 does. So CMS Title 19, you would have visits and units populated, but most insurances give you a visits and don't give you the units. Going into one of these, let's go in here real quickly. I'll show you what it looks like. Again, most of the time your administration team is going to fill this out. The type of auth is insurance. I went into an OT. This is Aetna. You have the auth number, start and end date, the frequency and duration. If it's per week or per month. If you are ABA and you know that you get a lot more visits than PTOT and speech. PTOT and speech are allowed 4 modalities or units in a day. Obviously, BA is authorized a lot more. So you would click other amount and you could put any amount in here that deemed warranted. Then you have your total visits and total units. These bottoms are editable, so if you are just starting into TheraPlan, and if you're watching this, you probably are, you know, you'd have to calculate where you are in the authorization when you start using TheraPlan. So I'm just going to cancel out of that. We'll go on to documentation. You're going to find documentation that you're going to be in this screen a lot. This is great for research, going in and seeing what other providers are doing, seeing and looking at your notes, or reading other providers' evaluations. Again, you have a table. It has some to and from, that has the functionality of uploading and downloading. So we'll spend a little bit of time on this screen. If I am a PT and I want to see everything that I have done, I will put in Donna, or just start typing in Donna, and everything that I've put in is going to come out. So that's going to cut it down. If you can imagine, if you're treating a patient for a year, there could be a lot of pages to this. So you'd want to go to all and use this search bar, so it cuts down. If I wanted to print out these two notes for a patient that wants it, I would click both. If I wanted to print out everything, I would click this top, but I don't. I just want these two, and I'm going to push download. It's going to go. This is just like downloading from any application. That's that same process. Okay, so the window will pop up. Where do you want to save it? I'm just going to pick downloads. I'm going to save it. I happen to already have one in there. And now it's going to come up. At this point, you can fax it to anybody. You can print it out for the parents, anything that you want to do. But this is that evaluation along with that daily progress note that we selected. So I'm just going to exit out of that. So also in this documentation accordion, you can upload documents. Now this is if you are just starting in TheraPlan, you're going to want to front load, if you will, some information into the system, maybe your last evaluation, your last standardized test, that patient's new patient paperwork, the financial affidavit, your last IFSP if it's early steps, but you would go in here and you would select. If I was putting in all the new patient documentation, I would say new patient documentation. I would choose the file. We'll pick, it has to be a PDF. I am going to go to my desktop. We'll put in logo, and we will put in the TheraPlan logo. Let's see. And this is new patient info. And I suggest you always want to put the date, where if you do this every year, if you have somebody fill out that, refill out the intake, you want to date it where this is 2018. So when 2019 comes up and you have them fill out that questionnaire again, or the intake, you have dates on it. Okay, so it's going to show up right here, the new patient documentation. If I wanted to print it, I'm going to click there and it's going to show it to me, and then I could print it at that time. So it's the same function as like any application, to download and upload. Are there any questions so far on documentation? Please, there's no questions typed up so far, but please just add that. I'm going to go on, and as I see any questions, I will go back and I will check that out. So referring provider obviously is very important. This is something that if you're looking at your documentation, or you're going into the referring provider accordion and this is not populated, you would want to make sure that you get this populated, because this has to be on your documentation. The administration team has the ability to build a database of referring providers, and as you start typing this, I'm going to clear all out of here, and I'm going to start putting in the NPI, and from the database inside of TheraPlan, you see Henry Dumas is the PCP that we will be adding. So I'm just going to save it so it makes sure that we do not lose that information. Patient cases. So I still see there's no questions to anything that we've gone over so far. So now we are on patient cases. Patient cases, if you can imagine, this is how, this is painting the picture of this patient's care. You have the normal table with the status and the visual cue on the right-hand side. If you want to add a case, which for many of you, this will be a function of your admin team, you would just add a case, which that is gone over in the administration tutorial. We're just going to go into the case, and we will go over all of the different cells inside. So this is PT. Donna is the provider. The location for services is Winter Park Clinic. The status is open. The primary insurance is Aetna. This patient has early steps secondary. Now, early steps in this illustration did not authorize physical therapy. So I am not going to have early steps as a secondary insurance to Aetna on this case. If early steps authorized EI, under the EI case, I would have secondary early steps. So that's a big functionality in this, that you can make any of the insurances in the accordions a different payer sequence in the case. So if early steps was secondary on the PT case and Aetna denied, I could make early steps primary and bill directly to early steps instead of always billing Aetna and then on the back end billing early steps. So what that means in the system, you get paid probably 6 weeks quicker if you are able to bill straight to the secondary. And in many EMRs, you don't have that luxury of changing the sequence of insurances. Down here, you have your diagnosis codes. 3 are listed, but if you need to have more, you would just add more, and you could put in as many diagnosis codes as you see fit. One thing I will tell you, please make sure that this is filled out. You'll notice that there is no decimal here. So if I wanted to add a diagnosis code, and let's say F84, okay, it's a smart cell, so it's going to come through and it's going to give you the autism spectrum. I'm going to pick F84.0. We know that it's supposed to be F84.0, but in billing, the decimal is dropped. It is not communicated to the insurance. So you can fill out as many diagnosis codes as you want. Authorizations, I showed you the authorizations in his case. He had a PT authorization. Either you or your administration team, in most cases your administration team, is going to take that authorization and they are going to say, I want this authorization to go with this case, that PT authorization to go with this PT case. So you would assign, and it's already done, we would, by clicking this and making this primary, this is the Aetna policy, that is assigning that authorization to this case. So now whenever Donna makes a daily progress note, it is going to decrement from this case. So you'll notice that this will go down to 20, 19, and it will down count from this authorization. You can have multiple authorizations. If you have 2 therapists treating the same child for PT, you assign that one authorization to both cases. So whatever therapists treat that patient, is going to decrement. Encounters, these are all the encounters that Donna saw John. it gives you those visual cues. It tells you how many days are open, the dates of service. You can go through and show different amounts. Again, this will get very lengthy if the patient is very involved. This could be, 10 pages. You can just go here and say select all, and it's going to list all of them so you can pick. And then obviously you can go to the top and you can get them all in order. The therapy care plan, that is another tutorial. Please, if you have any questions on the therapy care plan, please watch that tutorial. This is a very good tool that I can see everybody using a lot. Our therapy care plan in TheraPlan is twofold. You can update an insurance, or you can update or add new goals, which would act like a plan of care that you would send to the doctor and have him sign. Obviously, if you are updating the insurance, you do not have to get the doctor to sign it. You just can send that in the middle of an authorization period if they ask for an update. So we're going to go back to patient. If there's any questions on the cases, please get with me. I'm reading a question here. Okay. That's a good question. From this, the question is, can I get into any other cases besides my own? In cases, you cannot. You have to only go into your case. I am signed in as Donna, so I can easily go into my case. As a provider, you cannot. If you notice, I try to go into another case, it is going to deny me. Because it doesn't want, the system is not going to allow you to change anything, because once you're in a case, you can change anything. So we are going to go, let me get back to John. Where you would want to collaborate is under the documentation. If you go in the documentation, you can see everything that other providers have done. So you are only allowed into your case unless you're administration. But if you want to collaborate and see what other providers are doing, you can go in here. This is a speech note. I can click on the speech note, and it's going to bring up that note, and it's going to allow you in there, and you can see exactly what information is in this note. So we're going to go back to patient. Good question. Thank you very much. If there's any other questions, please feel free to ask those questions. Next three visits. This was put in an accordion. If you're in somebody's house and you're saying goodbye to mom, saying what you did in that visit. Hey, when's the next time I'm coming out? You can come to this and you can just recap with the parents the next visit or the next couple of visits. During the summer, obviously that makes a lot of sense. You want to make sure that they're not on vacation, or you're on vacation or anything like that. The patient notes, we put in that one note, mom is going to be late again. That is the note that I put in under patient notes. Just to add something here, if you want to document a visit cancellation, you would add a new note. You could come here, visit cancellation. You're going to just populate this. Date of service 7/17, and the reason sick. So now when you're in here and it's been time and you have a problem patient that keeps on canceling, you can come in here and put visit, and it's going to come up visit cancellation. Every cancellation you've had, you would be able to say, mom, you were you canceled 7/17, and you can have those discussions with the parent and or documentation to give to early steps or whatever you need, or documentation to show that that patient calls in. The ledger, this is an area that you can kind of just at a glance see exactly what's happening with this patient's care. I would go here and put all. So there's only one page here, and then you can manipulate these by getting them all grouped. And you can do these by any category, any title of the table. And I'm going to say, if there are any questions on any accordions through TheraPlan, and while I'm waiting, if anybody puts a question on there, the reason why we decided to go with accordions throughout TheraPlan, because it respects your space a little bit more. You'll notice when I go onto patient personal details, it is going to center that accordion in the middle of my screen. TheraPlan is responsive technology, so it is going to change the screen by what device I'm on. So I'm actually on a 32-inch screen, but if you are watching this from a smaller screen, it's going to look different than it would in what I'm looking at. So on your phone, it's going to be a lot more vertical. You'll notice that this dashboard is very horizontal. As you get smaller screen, it's going to be more vertical. Like if you're on a phone, the scheduler is going to be first, then patient list, and it's going to go scroll up and down on your screen. So that is why because you open one, the other one closes, and it's all viewable, and you can fill in the information. I mentioned that we have web technology in here. So anytime that you see this little envelope by an email, you can click this envelope and it is going to open your email service. So, if your email service is not encrypted, this email will not be encrypted. So you'll need to make sure that, like I use Office 365, and all I have to do is put secure in the title, and my email is going to go out with requiring a password from that end user. Okay, so there's no questions on the accordions. Got a comment that they like the accordions. So excellent, thank you very much. So now we're going to go into really kind of where you're going if you wanted to research something. I'm going to show you the cases again, just to spend 2 seconds. If you want to review a note, what did I do 2 weeks ago? What was I working on? I want to read my last evaluation. The best place to go if you are the provider is go into this little package being a case. Everything about what you are doing with that patient is going to be in the case. You have all the pertinent information. Make sure this is filled out, the authorization that you're dealing with that case, and then you can come here and you can read your last eval, you can read your last treatment, whatever you want to do, or if you want to make a therapy care plan. So you're going to find yourself using these cases a lot in any of the research that you want to do on any particular patient. If you want to collaborate, you want to do and check for speech, what the speech provider is doing, then you would go under documentation. You would go under documentation. You would find any of the notes that you want. You could put in speech here. And all the speech will come up. And you would be able to, look at any notes that you wanted to. Lastly, help and forms. Help and forms is that place that you can go to get additional help. We are putting videos, those should be out very shortly, where you can come and watch the videos of the scheduler, the payroll, all of those, that good information. If you wanted to look at this webinar again, you could go in under TheraPlan webinars, click on it, and be able to watch that video again, or that webinar again. need help, you can either call us here, you can email us, or you can fill this out. I would suggest if you are just getting into the system, we have some great guys at our help desk. Give them a call, get a relationship with them. You'll find that every phone call that you make with them, you'll get a little piece of knowledge and you'll understand the business process within TheraPlan even more. Bug Tracker, we are on 2.0, but this is software. And I know Clinic Source has been around for 20 years and they still have bugs in their system. So I'm not here to tell you that, TheraPlan is perfect and you're never going to get undesirable situations. But if you do, give us a call or fill this information out. If you have any suggestions on enhancements, please engage us with that. We are in 2.0. And so, we're still in our infancy and we are building TheraPlan to try to make everybody have that EMR system that they like to engage in. I know that not very many of the EMRs out there now, you can get excited about. We are putting in the end user, the provider's wants into TheraPlan. So please engage us, and we will do anything that we can to make this experience and add to TheraPlan, great. So I wanted to thank you for watching this. Please engage the help desk if you have any additional questions about anything. I do not have any questions on the queue. I appreciate your attentiveness and keep using TheraPlan. Thank you. Bye-bye.